cover today?
Yes, a lot to cover. Thank you, Kathy, for that nice greeting. So good to see your face. And so many other familiar faces. Welcome, whether we've met before or this is our first time spending an hour together. Regardless, I'm just thrilled to be coming back for part 2 of this webinar series. So because we do have a lot to cover and this is part 2, I'm going to go through a really speedy introduction. I am going to share my screen and then we'll go through just a few preliminary reminders or I guess introduction, and then we'll move on from there. So here comes my screen and slideshow coming soon. There's always this like brief moment where you hold your breath and hope everything works right. There we go. Okay, so as Yasmin mentioned, this is a series called Foundational Approaches in Practice. It is a 3-part webinar series. The first one was on the 21st of May. If you attended, I'm so glad. If you didn't get a chance to, please go back and take a look at that. And it is available if you register via your email, and it's also on the Wise Woman Herbalist Practitioner Learning Community webpage. So then today we're going to dive right in and build upon what we discussed last time. So we talked about the 5 foundations of health and the importance of a systems-based approach to healing, and now I'm going to get more specific with nutritional therapy. So the ways in which we can use both food as medicine and nutrients and supplemental formulas to therapeutically support and rebuild the foundations. And then for our final of that 3-part series, that will be Tuesday the 16th of July. Please do register for that. That's when I'm going to talk about one of my favorite things, which is botanical medicine specifically. So there's definitely a crossover between today's topics and our next Q&A, our next Zoom call, but I'll dive into specific medicinal herbs to strengthen the foundations on that next call. So as you know, I am a nutritional therapy practitioner, proud practitioner and educator for that organization. So thanks to the NTA for sharing this slide and this image. Just to catch everybody up to speed, if you were not a part of the first webinar, we at the NTA see the body having 5 particular pillars or foundations of health. And when we work from that understanding that we are a series of complex systems anchored in these 5 foundations, we have a new way of looking at the body's ability to heal and to achieve optimal wellness. So we're looking at eating the right things and also specific targeted support for each of those foundations to give a solid structure upon which we can be nourished and achieve optimal health. And what optimal health means to me might be different for somebody else. And just a reminder, that doesn't always mean complete resolution of every symptom. There is definitely value in the process of learning and healing and becoming more in tune with our body. So we never ever stop that process. It's an open road to the very end. So we continue to heal each day the more and more we listen to ourselves and honor the roots with which we are connected to the earth. So the 5 foundations: digestion, blood sugar regulation, dietary fats, minerals, and hydration. And encompassing all of those is the primary foundation, which is the nutrient-dense, properly prepared whole foods diet. So from there, oops, rewind. I shared this slide last time, and it's just, you know, a symbol of the importance of a foundation when we're building any kind of a structure. We live in this very complex world. There are so many different factors that contribute to our day-to-day well-being. I shared last time the wheel of wellness, all of the different spokes within that wheel that really encompass our greater well-being. So here is just an analogy. You know, if we don't build a strong foundation for a house, it becomes obvious later on. And if we were to relate that to our physical health, this is the way some of that instability in the foundation might show up. So a house with a poorly built foundation might stand out to you because it will, it might lean, it might show visual instability in some way. For us as human beings who have unmet foundational needs, or through a series of diet or illness issues that have manifested in specific concerns that become chronic, these are some of the things that we might see. So hypertension, depression, high cholesterol, cardiovascular disease, type 2 diabetes, substance use disorder, and autoimmune conditions. These are becoming more and more evident in our country, and these in particular I listed because they're known to cause some of the most negative impacts on our quality of life. So I just want to share, I have a husband who is a first responder, and he just went and attended an advanced training to keep his skills sharp. And thanks to him, and thank you to all the men and women out there doing that very important and amazing work to respond to emergencies. And the first thing his instructor said was, "You're all here for advanced level training, but I want to remind you that it is advanced work is nothing more than refining the basics." And I felt that was really relevant to what we're talking about here as well. So where there is so much complex pathology, so many different factors contributing to our health, we really do need to go back to the basics. And the more we understand and support those foundations, the more able we are to build a solid structure. So how do we do that? How are we able to rebuild? Well, it's a series of steps. So, thinking about these tiny little sprouts, each one a symbol of hope for what is yet to come. And in these sprouts, in this very early stage of growth, you know that there's a compact amount of nutrients within each little bite. So it's power-packed. These little tiny steps are so powerful. So I really want you to keep that in mind. How do we rebuild? How are we going to support the foundations of our own health and that of the clients that we see? Well, we need to take a look at their symptoms. And I'm curious just to have a sense of who is in attendance on this call. What are some of the ways that you are assessing your clients? So I am happy to have you unmute and share, or you can type into the chat box. But what modalities do you use, or what methods are you using right now to assess your clients and their symptoms? Okay, wonderful. So someone mentioned food and mood journaling. So an assessment of the way a client is eating and the emotions, the reactions that might be associated with those dietary choices. Excellent source of really valuable information. And I see someone else mention NTP skills, a very special someone else. Hi, Melissa. So nutritional therapy practitioner skills, meaning functional evaluation, so hands-on assessment of reflex points associated with various organ systems. So a fantastic way to assess the body's needs on an individual level. Someone else mentions the NAC. That stands for Nutritional Assessment Questionnaire, if that's not something that you're familiar with. Functional evaluation. And these are two really useful tools shared within the NTA training program to help assess clients and what their symptoms might be associated with on a foundational level. Fantastic. Thoughtful interviewing, I really love to see that. And hi, Linda. Thoughtful interviewing is such an enormous tool that we have, and the more we use it, the sharper those skills become. What a powerful way to get to know the needs of our clients. Kathy uses the functional evaluation and her own blend. Oh, I like to see this, of energetic testing, coupled with deep interviews as well as physical observations. So a holistic approach to looking at the expressions of the body on multiple levels. I love that. Also nutritional assessment questionnaire, functional evaluation, and then also GI map, stool test, and micronutrient test. Fantastic, super high level, really valuable sources of information for our clients. So all of these and more are available to you depending on your modality and training. We really do have to look at symptoms. I think I just saw one more chat come in. Sorry if I missed that. Vicki, hi Vicki. All the nutritional therapy skills and assessments. So you're also looking at their eyes and their tongue. You ask a lot of additional questions to look for triggers. Wonderful. Past and present, energy patterns, etc. Home environment, learning, muscle testing now. Hats off to you, Vicki, for that amazing arsenal you have. We are all trained in our own ways and skilled in recognizing the expressions of the body, whether it's on a physical level, an energetic level, the ways clients will communicate their specific desires and needs. And we also know that a symptom is not the final expression and the only place we focus our support, right? It's a message from the body. It's a clue. And I love the comments about digging deeper, thoughtful interview, asking about antecedents. We want to know what happened before that. What was different about that time in your life? What else can you connect to the development of this particular symptom that is an issue for you right now? So symptom assessment is super important. And then the digging. We have to do our due diligence to really identify where the support is going to be the most valuable. Where can we get the most bang for our buck? Then we start to connect the dots. So the more clients we see, the more we get to know our own body, the greater level of dot connection we are able to do. So taking a piece of information here and a piece of information here and beginning to recognize the relationship between the two helps guide us to the root or the trigger or kind of the fundamental need of the body. So we do this from a step-by-step approach, and we work from the ground up, so to speak. And when I say that, I mean the foundations. So starting with the diet, and then we have these 5 foundational pillars of health, and the majority of bigger, more complex issues a client might be dealing with are so often a consequence or a result of instability in one or all 5 of the foundations: digestion, blood sugar, fatty acids, hydration, and mineral balance. So there's my big cheer for plant medicine for the win. I firmly believe that nature offers us so many valuable tools to support our body. And there is a wide range of medicinals out there. There isn't one exclusively that I believe is most important. We need to recognize a multifaceted approach to care. But so often the power contained within the plant world and the plant kingdom is profound in terms of supporting healing for our bodies and those of our clients. So next, I want to bring up a reference that will be a companion for the remainder of this webinar, as well as our number 3 webinar. So if you received this in your welcome email when you registered, it will be good for you to follow along. If you don't have it now, you will be receiving it as a thank you for attending this webinar. I am going to stop share for a moment, switch screens so that I can show you what this looks like briefly. Here we go. So this document is one that I created, and I gave it the title Foundational Support. And I am a really big fan of taking large amounts of information and condensing it into a document that is accessible so that you can take little bits at a time as a practitioner in your healing modality and begin to incorporate these recommendations. The more you work with just a few different pieces of this document, the more familiar you are, you're developing a materia medica, so to speak, and from there you can just build and build and expand. So know that this document is really, really dense with information. I have broken down the 5 foundations by each section. So the various organs all involved in that particular system. So as you can see here, digestion has 5 pretty specific organs that are involved, and digestion can't happen without each of these, right? So working from the northernmost point of the digestive process, working your way down, I have given a column for therapeutic foods to support each section of that digestive process, nutrients and supplements, and then herbs. So herbs will be the topic of conversation for our July webinar. So do just appreciate the amount of information here. You'll see that there are a variety of foods that you can, if you have identified a need for support in one of those particular areas, you can go right to this chart and say, hey, what would be great for supporting my liver gallbladder? And you can begin to incorporate those foods and use them for eating for pleasure. You maybe eat them already, but it could be that you increase the quantity that you consume to bring it to a more therapeutic level. Many of these foods can also be used to LNT if you're an NTP and using the functional evaluation. These are a really wonderful way to bring food into the FE assessment process. So just a quick kind of high level, I'm zooming out right now and showing you the full document. And then I'm going to dive in and focus specifically on a few key pieces of this. You'll have this as a reference to come back to again and again. So you saw there was digestion, and then there's blood sugar. Blood sugar is broken down into the organs, fatty acids as well, based on the functions involved in fatty acid emulsification and transportation in the body. And then hydration and mineral balance. And at the bottom, you'll see a couple of resources that I recommend. And I just want to restate a disclaimer that I put at the very beginning here too, that the information in this document is not meant to be medical advice. I am not a medical physician, and so I just want to give that disclaimer with a careful statement to say that there is tremendous value in incorporating dietary changes, in the implementation of nutrients and supplementation, as well as botanical medicine or botanical herbs in your practice, areas of deep study for me. But I am not giving specific medical advice, nor specific dosages. So where I do mention dosage in this presentation today, that information is coming from studies that have been done on particular nutrients, and I will just suggest the dosages that have been used for each of those studies. So there's the big picture document, and because we have a limited time together, and this would take a decent amount of time to go through thoroughly, I have chosen to focus specifically on digestion and blood sugar for today. So coming back to my slide, here we go. The foundational support chart is a really useful tool that I hope everybody appreciates and finds to be helpful in your practice. I'd love to hear feedback from you if you are using it or find it to be helpful. So now I'm zooming in a little bit more and focusing on digestion specifically. So I've got a table here where each of these 5 components of the digestive system are reflected or represented. And then based on whatever assessment tools and techniques you're using, you may have your own way of identifying a need for support. So I have this area which says indication, a couple symptoms or clues from the body that suggest there might be a need for nutritional therapy or specific building up in that area. Upper gastrointestinal tract. Many people need to start their support there, not necessarily because that's where they're having symptoms, but because that is more or less the beginning of the digestive process. So if we're talking big picture, we understand digestion begins in the brain because digestion is a parasympathetic process. So two different modes of the autonomic nervous system. The parasympathetic process supports digestion. Now, if someone is having symptoms in the upper GI, maybe it looks like reflux, or maybe it's not showing up in the upper GI, but it's more common to see issues in the small intestine or the large intestine, any range of gastrointestinal disturbances. Maybe there's undigested food in the stool, and that's a clue. Even though that's the final part of the digestive process, we see the output. That's a clue that we need to go back to the very beginning and see where there might be a deficiency or an imbalance in function. We need to determine if there is support indicated in the upper digestive system, do we need to stimulate secretions? Could it be that there's a deficiency of those juices that support full breakdown of the food that we're eating? Or is there perhaps a history of gastric ulcers? Is there long-term antacid use? Or is there long-term non-steroidal anti-inflammatory drug use? Two of the most common causes of ulceration in the gastric environment, right? Then in that case, maybe we don't need to support additional secretions immediately, but first we need to look at healing. So you'll see there's therapeutic foods. We're stimulating secretions in the upper GI, and then there's nutrients. The food that I'm picking, and there are many, many, many in the document, I'm selecting one food and one nutrient to represent in this chart today, and then I'll take a few of these and go into even more detail on it. So bitter greens can help your body to produce more gastric secretions. And when we have adequate acidity in the stomach, we are fully breaking down the food that we're consuming. The taste of the bitter in the mouth is what stimulates the secretion of the juices, which then stimulates the conversion of pepsinogen to pepsin and tells the rest of the GI system that it needs to be prepared to do its respective duties in that process as well. From a nutrient perspective, zinc and B vitamins, these are two really important cofactors in hydrochloric acid production. I'm going to come back to that on my next slide. If someone is in need of gastric healing, cabbage juice, which there's unbelievable amounts of amazing data suggesting that this is, equally as effective as pharmaceutical medication for helping to heal the gastric mucosa. Or there's a nutrient chlorophyllin that can help heal. Moving down the GI tract to the liver and the gallbladder, this really important organ duo that helps us emulsify the fats that we eat. How do we know there's a need for support there? Well, it might show up as greasiness with bowel movement. Or maybe there's just general intolerance to greasy foods. That often looks like nausea. Someone will have a heavy, greasy meal and feel quite ill, and or tenderness in the right upper quadrant. A food that we love to love and we support the liver with often and talk about so much is beets. And in addition to beets, I'm going to talk about celery as being a really useful tool to support liver gallbladder function and biliary sluggishness. B vitamins, again, for the cofactor support. And I'm going to pause here just for a minute to emphasize that term that I'm going to use a lot during this conversation, which is cofactors. So we have millions and millions of enzymes in the body. the enzymes that we are eating do not even closely match the amount of enzymes that are produced and used in our body. And those enzymes are fueled by nutrients, many times minerals, but also vitamins. And our whole body operates on a series of enzymatic reactions in the body, and those enzyme reactions cannot occur without the presence of various nutrients like zinc, like B vitamins, like magnesium. So when I say cofactors, I'm talking about those specific key micronutrients that are fueling conversion of enzymes that are supporting things like gastric acid secretion and so many other functions in the body, gluconeogenesis, digestion, detoxification, all are enzyme driven and require nutrients. So that's really getting down to the root of the issue, rather than just seeing that somebody is having perhaps some reflux and giving them something to soothe the inflamed esophageal mucosa. That's a Band-Aid, and it's useful, and the person who has relief will appreciate that. But is that really eliminating the cause of the reflux? No. So coming back to the liver gallbladder, beets are a wonderful food for the liver. I'll talk more about it. B vitamins are a cofactor that helps support biliary production and also viscosity. The pancreas sometimes is underappreciated, but so critical to the way we break down the various foods that we consume. If we lack adequate pancreatic output, it might show up as undigested food in the stool. To combat that, we eat enzyme-rich foods. And guess what? If you are eating whole, colorful, fresh foods, you are consuming enzymes to help break down that food. So ways that we can even elevate that enzyme quantity or enzyme load, or what I like to say is the vibration of that food, is through fermentation. So looking at methods of fermenting foods that will increase the amount of enzymes, supports that natural process of digestion. But there are some foods, and tropical fruits in particular, that are especially rich in enzymes. So, you know, I wouldn't complain about having a slice of pineapple along with my meal, or papaya, naturally rich sources of bromelain and papain. And then if you want to look at supplemental support, more enzymes. And that's exactly what a supplement is. It is adding to the work and the excretion that your body is already putting out. It's not meant to replace it, and it shouldn't be used as a way to tell the body, don't worry about it, you don't need to do that job anymore. So in that case, supplemental enzymes, whether you go for a plant-based enzyme or an animal source, take it mid-meal. Give your body a chance to do that secretion that it already knows how to do so well. Honor that wisdom of the body, and then just give it a little helping hand if you identify a need there. For the small intestine, particularly common symptoms of irritation in the small intestine are gassiness and bloating and an upset stomach, for lack of a better term. Many people will just say, oh, I just really don't feel good. I ate 20 minutes or an hour ago, and I'm just feeling a lot of burning and gassiness and bloating and distension in my belly. And within a few hours, often that shows up as flatulence that doesn't smell very good, diarrhea. And if that's the case, you really need to not just go to healing or supporting the irritation in that area, but looking upstream. How is it that there is something irritating continually moving through the small intestine? Is it because I'm not fully breaking down food? Am I not in a parasympathetic state? Am I not chewing fully? Do I lack the secretions necessary to support smooth movement of that chyme through the small intestine. So it's not just that you would give some healing support with bone broth and L-glutamine, or if you identify an overgrowth of bacteria in a place where bacteria really is not meant to live in the small intestine, eradication might be appropriate. And there's some really fantastic foods like coconut oil and garlic, and or caprylic acid or lauric acid. These are all foods and food-based isolates that are antimicrobial, and we can consume them in moderate quantities all the time to help facilitate that clear and smooth movement of chyme through the GI tract. And if you identify a need for more focused eradication support, that would be a more involved process or protocol for another time, for another conversation. So then moving on, large intestine being the last part of that digestive process. People usually know when they're having large intestine issues because they are constipated and they know what that feels like, and or chronic diarrhea. Also, that's a pretty localized sensation in the lower GI tract. Perhaps someone will see mucus or blood in the stool, symptoms of bigger, more serious issues. So contact your medical provider if those are issues for you. However, food for the colon, butter, a fantastic source of butyric acid. I'm going to go to the next slide and talk some more about some of these really specific nutrients, because the research is there, you guys, and it's really compelling, and it's really exciting to see the way these nutrients can be used and even rival the effectiveness of over-the-counter and prescription medication for these particular issues. So moving back to gastric ulcers or ulceration in the upper GI, there was a question at the very end of our webinar 1 about H. pylori and what's a foundational approach to that. And what's really important to know is that H. pylori likes to thrive in an environment where there is inadequate hydrochloric acid. And many times we have inadequate hydrochloric acid in the stomach because, well, it could be we're not chewing our food and we're not mindful and we're not giving the body the setup that it needs to be acidic. But it could also be the kinds of food that one is consuming. If they are not naturally rich in enzymes, then you create an environment where there might be too little hydrochloric acid, then the body will make kind of overcompensate, and there might be too much, and then there's too little again. And that's the environment where H. pylori might like to take hold. I'm going to pause because I saw a couple chat questions come in. Yaz, can you update me on that? Or, oh wait, here I see.
Sure. We got some compliments on your chart, and we also had some feedback on I can't talk. Your view is not on presenter view fully.
Oh, well, that's really helpful for me to know. Thank you. Let me see here. How does that look?
Looks good.
Okay, cool. Thank you. Hopefully you can see that better now. So from a foundational perspective, if there is a known H. pylori infection, look at why that environment was even hospitable to that particular infection in the first place. Many times it's a hypochlorhydric situation. And how do we help support the production of hydrochloric acid in the GI tract? Well, zinc is one of those critical cofactors to that HCl production in the body. So zinc has so many functions and is a cofactor for multiple enzyme reactions. And one of them is specifically about the critical nature of zinc in producing hydrochloric acid for the stomach. So the standard dosage range is really wide here, 5 to 45 milligrams per day. So deficiency is so super common. So many of us don't have enough zinc. And so 5 milligrams might be on the really low end for someone who's very deficient. That might be more of a maintenance dose. Do exercise caution with zinc supplementation because it can have a counteractive effect on copper levels in the body. And the other concern is that you might be supplementing zinc that you're not actually able to break down because you don't have hydrochloric acid, which is a key piece of mineral breakdown in the digestive system. So you can see that there's a bit of a vicious cycle going on here. We need zinc to produce hydrochloric acid. We need hydrochloric acid to break down our zinc. And so starting with a smaller, more bioavailable form of zinc supplementation is really appropriate. So that would be one of the more foundational ways to address that particular issue. And then working with a trained provider on eradication of H. pylori will be, of course, a big piece of that. And then what about the ulcers that remain post-eradication? So there's still some rawness, there's still some irritation, and there is this fantastic vegetable that it costs pennies. It's so available to all of us. It's delicious, and there's heaps of studies supporting its use in a therapeutic way, and that is cabbage. So in the Brassica family, there's one variety in particular called Brassica oleracea, otherwise known as red cabbage. It's been long used to heal ulcers. It contains a mucilage that coats the lining of the digestive tract. It can also protect the stomach from irritants. So it is not just coating the GI tract, but it is also protecting it from further ulceration. So it has anti-ulcerogenic effects. Tons of studies supporting this. Here's two. The glycosides in that cabbage, the enzymes, the vitamins A, B, C, and also the sulfur compounds all together are going to protect and counter the effects of mucosal oxidation that can occur when we have those reactive oxygen species or oxidative effects going on in the stomach. So it can be used for peptic ulcers. It can also be used for more general gastritis, and then things like heartburn and even ulcerative colitis further down in the GI tract, but still ulcerations. So tons of great support for both zinc and cabbage. So the dosage recommendation here is a range, and this is a liquid form. So juicing cabbage, rich in what is known as a vitamin U complex, 8 to 24 ounces a day. So, you know, there's a study from the 50s that says a quart a day for 12 weeks, sufficiently healed ulcers related to H. pylori infection in the stomach. So not everybody wants to drink a quart of cabbage juice a day, but if you know this is an issue for you, it would be worth considering at least 8 ounces a day, maybe 3 cups a day if you can go for it. You might grow to even love it and crave it.
Hey, Rachel, we have a question from Rebecca.
Sure.
She asks, why is zinc a common deficiency?
Oh, yeah. Why is zinc a common deficiency? So it has to do with a lot of different factors. One is that we have the soil depletion and the foods that we're eating, and also the zinc-rich foods that people are not eating very often, like shellfish foods. So either you're eating crops that are grown in nutrient-depleted soil, or you're just not reaching for oysters very often. So I know I'm guilty of that. I'm not a huge fan of oysters myself, so I'm looking at other forms of zinc in the diet. So many of us just aren't consuming enough, and then others of us are just depleting it too quickly because it is used up in so many enzyme reactions. Then kind of the secondary explanation for that is because of the large amount of the population that does not have enough hydrochloric acid to even break down and absorb the zinc in the foods you are consuming. Thanks for that question. I'm having a frozen slide moment. Thanks for bearing with me. I think we're getting there. All right, super. So then moving on, we have discussed the importance of zinc and also the value of bringing in brassica juice for healing the upper GI and stimulating secretions. But what about the bile? The bile is so important. And we have some really great tools for this as well. One is beets that I talked about. We know that beets contain betaine, which is something that can thin the bile, and it also helps to prevent the formation of gallstones. And it's also a rich source of hydrochloric acid, which is critical for digestion and triggers the release of bile from the gallbladder. There's also super evidence about celery juice. And I know that celery juice is all over and everyone's talking about it, and it's kind of the topic of the day. Somewhat deserving, and there's also a great argument to say just eat the celery. Don't just juice it, but go for the whole stalk of celery as often as you can get it, because there's just too much good stuff in there that you'd be losing if you just extracted the juice. However, this study right here is proving the fact that those with high cholesterol levels can have a decrease in total cholesterol levels by incorporating celery juice. And the reason for that reduction is because celery juice increases bile excretion from the liver and the gallbladder. And the bile is what is carrying the cholesterol out. So juice your veggies, whether it's cabbage, beets, or celery, or all three, and enjoy that in moderate amounts. And then I want to get to this last part of the digestive process, which is the colon. Butyric acid. It's the principal energy source for colonic epithelial cells. So butyric acid plays a really important role in maintaining this stability of that gut microbiota. When we eat fresh foods, the fiber from those foods are feeding the butyric acid and feeding the cells, feeding the bacteria, which is creating these short chain fatty acids known as butyrate. And butyrate is in turn the fuel for the cells of the colon. So it helps reduce inflammation in the colon and also helps support regeneration of those cells of the colon. So multiple very, very important actions of butyric acid. And then blood sugar. So key components of the blood sugar regulation system, we have the pancreas, which is secreting hormones, insulin and glucagon, to decrease blood glucose levels or increase blood glucose levels respectively. The adrenal glands, the liver, and skeletal muscle. Along with these are the adipocytes within our adipose tissue. So how do we know when the blood sugar regulation system needs support? Well, the clues become clear when we have poorly regulated blood glucose levels. The symptoms of that we are becoming more and more familiar with, particularly hypoglycemia. We recognize the symptoms of that as being really uncomfortable, and this is a warning sign. Some people already have a diagnosis of hyperglycemia or diabetes, and some are in that in-between stage of pre-diabetes. There's hyperinsulinemia, or there are other symptoms of HPA axis dysregulation. So what do we do when there's a need for support in the blood sugar pathway? Well, addressing where the support is most needed is going to be really helpful. And then what foods can we bring in? So if we know that the pancreas is having trouble secreting insulin, how can we support insulin production in the body with food and nutrients? Well, chromium, zinc, and magnesium. So here we are again coming back to cofactors. All of these are supporting the secretion of insulin from the beta cells of the pancreas. Also bringing in foods like oysters and vinegar. So vinegar is actually part of that digestive pathway as well, where when we take in an acidic solution, it signals each of the respective organs in the system to secrete their juices. Oysters are actually known to help the beta cells produce insulin more effectively. Fantastic. Well, what if the body is doing an okay job of secreting insulin, but there is some kind of insulin resistance going on? We've got a lot of glucose running through the bloodstream. We have a lot of insulin, as you know, appropriately the body has produced to help escort that glucose into the muscles. But there is a block. There is an issue with the glucose uptake into the muscle cells. In that case, there's some really, really fantastic foods and nutrients that can come into play here. So vitamin C for the adrenal glands can help with that glucocorticoid production. Alpha lipoic acid and berberine are two of the most phenomenal nutrients to help facilitate insulin production and glucose uptake, and taken over a period of time can effectively reduce hemoglobin A1C, which is the average blood sugar of an individual over approximately 3 months' time. So let's talk about berberine for a minute, because it's just fantastic. So berberine is it's a really fantastic plant alkaloid. So it doesn't just come from one plant. There are multiple different plants that contain berberine, but one of them that grows in my particular bioregion up on the Colorado Plateau is barberry. And it's really amazing to see. If you scrape away just the outer bark of barberry, you'll see this very bright yellow pith just below the hard outer bark. And that is a berberine-rich source. So in that quantity, it's probably not going to be as effective in a metabolic application, but it's really fantastic for antibiotic functions. So many people know berberine for the antibiotic action, but it also has amazing, fantastic, powerful effects for insulin sensitivity. So there are some studies here that show, well, first of all, a standard dose is somewhere between 900 and 2,000 milligrams per day. In diabetic patients, in one of these studies here, berberine was given at 0.5 to 1.5 grams daily for an average of 12 weeks. And this particular course of therapy was associated with moderate improvements in all measured glucose and lipid parameters. So both average fasting blood glucose levels and your lipid panel, both of those things improved tremendously, because there's a deep relationship between lipid levels and blood glucose levels, as we know. And the results of this suggest that it can be equally as potent as metformin for people who are diabetic and trying to manage glucose uptake and insulin sensitivity with medication. Really useful. And then what about cinnamon? Cinnamon is really amazing. It can help support beta cell function. Studies here, subjects were given 1 gram, 3 grams, or 6 grams of cinnamon per day, and all of those groups had a reduction in their serum glucose levels, their triglyceride levels, low density lipoprotein levels, and total cholesterol in people with type 2 diabetes. So it doesn't matter if you're taking 1 gram a day or 6 grams a day of cinnamon, all of these people experienced a reduction in serum glucose levels. And we also know that cinnamon has really fantastic anti-inflammatory, antimicrobial, and insulin sensitizing properties. So all of these together are helping to manage type 2 diabetes, which, and this is, statistics that are now 19 years old, but in the year 2000, there were at least 171 million people worldwide with diabetes. So this is a big, big issue. And whether or not they have moved into a state of diagnostic criteria, or if they're kind of dancing somewhere in between, just bringing in cinnamon into their diet, which tastes good anyway, why not incorporate more cinnamon in the diet? And then look to things like berberine if you want to really kick it up a notch therapeutically. Oh yeah, good question. So I need to look, Kathy. I'm going to go back to my study and find out which particular variety of cinnamon they're talking about. So you mentioned Dr. Carrie Bone, and it's true that not all cinnamon is equal in this effect. But from my understanding, it's actually the more readily available variety of cassia cinnamon that has the greatest anti-glucose effect, and in supporting insulin sensitivity in the body. So I'll get back to you on that one, Kathy. I'm glad you asked, and I'll look up the variety. But as far as I understand, it is the very, very commonly available variety of cinnamon. Okay, and then in terms of adrenal gland function, the adrenals are really, really amazing. We know them to secrete all variety of hormones related to stress and also sex hormone production. If we're talking about glucocorticoids, though, coming from the zona fasciculata, we know that vitamin C is really, really important to the body. You know, we know that it helps with a healthy immune system, but it also has this really critical role in adrenal function. So vitamin C, not just for the immune system, but also for your adrenal glands. It's among the organs with the glands with the highest concentration of vitamin C in the body. So interesting, both the cortex and the medulla accumulate such high levels of ascorbate or vitamin C, and that ascorbic acid is actually a cofactor for the synthesis of these steroid hormones. So anytime our body is secreting cortisol, we are also having an increase in vitamin C serum levels in the adrenal vein. So really fantastic, fascinating studies here to suggest that when we are continually exerting this stress response and the adrenal is secreting stress hormones, that we're losing vitamin C in that process. So replenishing that is a cofactor to support our body in response. Plus, we get to do all of this outer work in protecting the body from an exaggerated response as well. Pausing for a question here. Oh, thanks, Linda. Cinnamomum cassia, certified by the Office of the Director. Thank you for that, Linda. Appreciate it. So there is an answer for you, Kathy. Cinnamomum cassia. And then one final nutrient that I think is really worth mentioning is alpha lipoic acid. And this is a really fantastic compound that's actually synthesized in the liver. So our body is making alpha lipoic acid all the time through the liver, but we also are obtaining it when we eat foods. So lipoic acid is present in plant foods as well as animal foods in the diet. And if we're talking about animal tissue, it'll be in a higher concentration in organ meat, things like heart, liver, kidney. And if you're looking to the plant world, look for all of the dark leafy greens, which we love to talk about all the time, but spinach, broccoli, Brussels sprouts are tops, and then there's also tomatoes and peas, and even the bran of rice are rich in lipoic acid. And what this particular nutrient does is help quench some of the ROS, the reactive oxygen species activity. So this is a chemical byproduct that is oxygen rich, that is actually oxidizing the tissue. And it's a normal process, but we can have an overproduction of ROS in, it's kind of a chicken or the egg scenario, but if we've got high inflammatory markers in the body, we have high ROS going on, and ROS creates more inflammation in the body as well. So how can we neutralize some of that oxidative activity going in the body? Well, our lovely antioxidant-rich foods, of course, but this lipoic acid in particular is really amazing for that. It also lipoic acid will inhibit glycation. So those advanced glycation end products, the sticky proteins that are a contributing factor to insulin resistance. So bringing in the lipoic acid in greater quantities than just what's produced in the liver can be a really useful method of negating some of the damage of elevated blood glucose levels on a chronic basis. So we can also see lipoic acid has a role in the Cori cycle, which is actually part of the Krebs cycle, which is producing ATP or energy for the body. So lipoic acid plays into the pyruvate and lactate conversion into ATP. So we're getting that energy from non-carbohydrate sources, also known as gluconeogenesis. So if your body is trying to take amino acids, or if it's trying to take glycerol and turn it into glucose, lipoic acid plays into that pathway as well. Finally, this alpha lipoic acid is preventing beta cell destruction. So the beta cells that secrete the insulin are protected when we have an ample supply of lipoic acid in the body. So those are the specific nutrients that I wanted to talk about tonight. And then these other foundations, fatty acids, mineral balance, and hydration. They are no less important, but I feel and see so often that when we are supporting the foundations of the nutrient-dense diet, and we are balancing the blood sugar handling system and also the digestive system, that those other pillars of health become often stabilized. So if you think about it, if we're supporting digestion, we're breaking down our minerals, right? If we are supporting digestion, we are breaking down our fatty acids. And if we are drinking water, this is helping support each of those enzymatic functions in the body that help keep us in a state of homeodynamic balance. So that completes my presentation for today, and I'll leave just a few minutes for questions. Until next time, I would love to invite you to visit my website, openroadbotanicals.com. There's a fun little PDF available to you called 3 Ways to Up Your Herbal Game. If you're interested in going deeper in your herbal studies, you can take a look at the products that I offer. If you are not a graduate of NTA and you're curious, go take their free course and get a taste of what amazing information you'll receive in their big 9-month program. And then I also want to guide you to the Botanical Fundamentals Kit that is available through Wise Woman Herbals, which is just a beautiful kit of 24 herbal simples that are first and foremost, a wonderful way to stock your medicine chest, but also if you have a testing modality available, you can start to bring herbs into your nutritional therapy practice right away. So I want to thank you all for your time and attention, and I'll see if there are any questions before we close out for the day.
Kathy has a question. Will you be providing your earlier chart for distribution to my NTP classes?
So that's up for discussion. Yep, I would love to talk more about that. And yeah, you and I can talk a little bit after a class too, because I think it would be a wonderful addition to what we're offering our students. Good deal. Yes. Let's see. Any other questions? Oh, Matthew, thank you for bringing up this alpha lipoic acid caution. It is a strong mobilizer of mercury, so use cautiously in supplement form if you suspect heavy metal toxicity without proper support and monitoring. Really super valuable caution, Matthew, and I want to thank you for bringing that up. So that's just a testament to the power of nutritional therapy, and while we are equipped with so much knowledge and skill to support our clients, we do have to approach this modality with a healthy degree of appreciation for the power of it, right? So that's a caution I definitely want to thank you for adding to the conversation, Matthew. You're welcome to those of you offering up thanks, and I send that right back. question about the webinars being available. And I can let Yasmin speak to that, but I believe that they either come in the thank you email after you attend, and or, yes, thank you, Yas. They're going to be on the Wise Woman Herbal's YouTube page. Oh, that's fun. Cool. Really good to see you too, Jenny. Really enjoyed sharing this time with you. Appreciate your attention, your great questions, your passion for this work, the ways you're healing yourselves and healing the world. I admire you tremendously. Final question from Kathy. My thoughts on blending versus juicing. Oh, yeah, that's, well, this, I love getting a question from my teacher right now. So when I was a student of Kathy's, there was this recommendation not to remove all of that wonderful fiber because then you're increasing the glycemic load on the body if it's just juice. But now we know that if we're introducing too much fiber too fast, it can actually be binding in a way that if your body is not open, if that pathway is not healed and smooth and supporting release, you can have a recirculation of toxicity. So as with all things, I think balance is key here. I am a fan of juicing, and I also do love my Vitamix. So we need the fiber, but it's just so bio-individual. So I say cheers to both forms of liquid plant beverages, to whatever suits your taste and your bio-individual needs, and cheers to you, Kathy. Yeah, so I'll let Yas speak to the chart and document. No. Okay.
Okay, so for the certification or the certification of attendance, unfortunately, we're not providing any type of certification on attendance for this event. But if you are part of the NTA community, I believe that there is a form that you can fill out and then submit in order to have this approved for a CEU. If in the future we have webinars that are for CEUs, we'll definitely that way you can prepare. And then in regards to the compliment chart, we will be sending that in the thank you email, which will be going out within 72 hours with the replay link and any additional resources from today's webinar. If you haven't already registered, like Rachel mentioned, her next webinar, it's part 3 of this series. It's Tuesday, July 16th at 11 a.m. And you can register through the Wise Woman Herbal's website, and that's on the practitioner learning community. If you need to register or need help finding that link, we'll have that provided for you also in the thank you email. And just a quick note, we have an exciting announcement from Wise Woman Herbal. So we just launched 3 new products this month. 2 are kava, and one is it's a nighttime support for sleep. So we actually launched our first standardized kava glycerite. So that's to support healthy response to stress and anxiety. And then we have a cultivated kava root. It's a kava capsule that supports emotional wellness as well as calm and relaxation. And lastly, Sleepy Time Glycerite. So that has chamomile, catnip, passion flower, kava, and valerian. So great support for healthy nervous system response and restful sleep, and especially if you need something with no alcohol. So those are new things on it. And if you need any help with today's webinar, again, resources or anything, feel free to contact us either through customer service. You can call them or send them an email, and we'll be happy to help you. And again, on behalf of Wise Woman Herbals, thank you so much for joining us today, and we look forward to seeing you in July.
Thank you, everyone.
Thank you, Rachel.
Thank you, Yas. Be well.
Thanks, Rachel.
Thank you.
You both. Thanks.
Bye.